first Monday in May is designated as Melanoma Monday. It's a day to bring attention to a type of skin cancer that is not just serious, but potentially deadly.
Dermatologist Dr. Jennifer Pennoyer diagnosed an early stage of melanoma on the arm of her patient Heather Zatola a few years ago, and they are both here to talk about what happened and what you need to know about this disease to avoid it. Thank you both for being here. Heather, let's just talk with you. You, for a while, thought this was your special freckle?
I did. I thought it was a cute little freckle, and I thought nothing of it. But I was out to dinner with a friend of mine, my friend Kelly, and she grabbed my arm and said, "What is that? You need to get that checked out." Her father had recently died from melanoma, and so she was aware of what it could look like, and she was right. I went to Dr. Pennoyer's office, and they biopsied it, and it was melanoma.
Dr. Pennoyer, I don't think people hear melanoma and go, "Oh, that's going to kill me." But tell us those statistics.
Well, melanoma is the leading cause of death in skin cancer, and every hour an American dies from melanoma.
Every hour.
Every hour. And it's going up, right? I mean, that's the problem, is it's just, the statistics show that it's growing.
The incidence is going up steadily over the last 30 years, largely probably because we're losing our ozone. So right now, it's 1 in 50 Americans will have a melanoma.
So you brought in a little chart here, and it kind of shows us what we should be looking at.
I think this is a good example because it shows a normal mole next to one that's changing in a bad way.
Okay.
So A is asymmetry, so you could cut the normal mole in half and one half matches the other, whereas this is growing in a funny shape that's not symmetrical. B is border. It should have a clear border. You know where it is, you know where it isn't. And you can see how when it's growing, it gets that thundercloud gray or funny colors, and you can't see the border well. Colors like blue and black we don't like. Diameter, really a changing diameter. Some people make all their moles bigger or all small, so you can't say one diameter is bad, but if it's changing and growing, we want to know it. And anything that's a new mole, you shouldn't, at later ages, you shouldn't get new moles. Get new other
You shouldn't be getting new moles.
No, not past the teen years.
Okay.
So time is really important, right? Heather, you felt very lucky because they told you it was stage
0.
Wow.
Which meant that it was just right there. They had to take some border skin around it, but after that, there was no problem from it. So,
what happens at stage 2, 3, 4?
You know, the survivability of melanoma is great if caught early. It's a 98% survival rate, and in our office, at least 96% are stage 0, stage 1. So it's great. The later you wait and the later in diagnosis, much lowered survival rates.
Is there, based on race, is there a certain race that's, more prone to this?
Certainly Caucasians are more prone. It's more common in women up to age 40. After age 40, it's men that have it more commonly, and most commonly on the back.
On the back.
Because we don't check it, right? And now, do you have different practices now? Are you asking your husband to look through your hair and your back, or?
Well, I do go to Dr. Pennoyer twice a year for checkups, definitely, and I definitely make sure that my husband sprays sunscreen on me on the back, because that's one place you can't really reach yourself.
Now, Heather's had one. Does she need to worry about another one or reoccurrence? Is she more susceptible than other people?
Correct. Her risk of another melanoma doubled.
Doubled.
Wow.
Right. So each time you have another one, you're at risk for another. Think about it. If all your exposure adds up from day 1, then at a certain point you're at risk for more and more skin cancer.
And Connecticut actually has one of the states with the highest incidence of melanoma.
I think that's due to the fact that we only get 6 months of sun, really. And so when the sun finally does come out, we all want to get some color. We think we need some vitamin D, and we all run out there and maybe don't use our sunscreen as well as we should.
Now, when I go, you're checking between my toes. There's no sun between my toes. How do they get? Is that something I have to be worried about?
Absolutely, because somehow your body knows how much sun you've had, and it has some sort of an internal clock. So you can have most of your sun on your arms and face, which is where we get the most sun, and have a melanoma come on your butt, between your toes, where the sun don't shine.
Right, exactly.
So we really have to check all over, and that's why checking your scalp, checking all those places that you can't see is really important.
And one last, is genetics, does a genetic have anything to do with it? Or it's much
less common to have a genetically related melanoma. It's only about 12% of melanomas, but it is there. And there are families where melanoma runs in the family. It's dominant. So you usually see it in mom, dad, brothers, sisters, or your kids. It's the close relatives. It's not distant.
And I know for you, Heather, you're a mom, you're a teacher. Has it changed you, the way you're talking to not only your students, but your kids at home, and how you're making them put on sunscreen?
Oh, yeah. And whenever they fight me on it, I remind them, you don't want to get melanoma when you get older. Remember what mommy went through. You know, you need to wear your sunscreen.
And you need to wear, let's talk about some prevention. This looks great.
That looks great on you, Scott.
That's awesome.
It's a little fashion statement, plus it looks great.
I think it's backwards.
Oh, it is? Okay.
It's Panama Scott.
Well, there we
There you go, much better.
Okay, so big hat, keep obviously the sun off your face, keep
You
it
know,
off your
the
head.
easiest thing is find the shade. Make
Find
your
the
own
shade.
shade. And that's the easiest thing, and then start from the top. Hat, sunglasses, the sun protective clothes are
Rash
important.
guards.
Yeah, the rash guards are huge.
These are amazing.
And they're cute now. Like, I know you showed me, actually it was Dr. Pennoyer showed me these ones by Athleta, and they're very flattering.
Yeah, they're form-fitting, so
I think
You don't look-
Karen made me go out and buy a rash guard before my cruise, so it was absolutely fantastic, and I love it.
All right.
absolutely.
Thank you for being on the show,
Thank you
ladies.
both
Thank you for having
shedding
us.
a little light.
Having
And for
us.
more information on Dr. Pennoyer and her practice, if you need to go get checked, head to her website. It's drjenniferpennoyer.com.
All right, for more information on Melanoma Monday, go to the website set up by the American Academy of Dermatology. They have a campaign called #LookGoodIn2016. The website is melanomamonday.org.